Talk about 5 signs you or your family member may be having heart failure. Because yes, there will be signs, and sometimes they'll be obvious. I will never forget the day that I got a phone call from a close friend telling me that they felt like an elephant was sitting on their chest. They felt like they were underwater and they couldn't breathe. I knew. It hurt so bad, but I knew. And I'm about to give you this education so that you can know too. Let's go. Number one, you finding it hard to breathe. Doing the activities that you usually can do just fine. Walking to the mailbox, all of a sudden you are winded. Getting up, getting out of the car, walking from the parking lot to the front of the grocery store. You can't keep up. You're doubled over. These may be signs that you have fluid in your lungs and you're experiencing heart failure. You might want to get it checked out. Next, swelling in the feet, the ankles, the legs. Baby, if your feet have gone from this to this, it could be heart failure. Why? Because fluid is leaking from these vessels into the surrounding tissue. Now I'm talking about both of your feet looking like this. If one of them looks like this and the other one looks fine, that's you got another problem, okay? But for now, if both of your feet are swelling, especially if you can press into the swelling and it leaves an indent, more than likely you're dealing with heart failure. We call that pitting a debunk. Do not pass go, do not collect $100, okay? Get in front of a healthcare provider ASAP. Next, difficulty breathing and coughing when you lay down. That's an important part of it, okay? Because when you lay down, now the fluid has shifted and pulled into your lungs. Some people can feel like they're drowning. Some people may not want to lay down flat. They feel better when they sit up and they could take a deep breath. But this is a sign you don't want to ignore. Oh no, you do not want to miss this sign because this is a classic sign of heart failure. Next, rapid weight gain. I'm not talking about you had an extra calorie or two and it's starting to add up. I'm talking about out of the blue, over the span of a week or two, you're putting on 10, 20 pounds. This is when it doesn't add up because it's fluid. Water has weight. We call it water weight. And even though you may not see that fluid in your legs, in your lungs, in your abdomen, you may see it on the scale and you may need to get it worked up. Next, your belly's poking out. You're uncomfortable, you're bloated, you get full easy. These are signs that you may have some extra fluid in your belly. Now, I'm not talking about, central obesity or belly fat. I'm talking about the belly is tight, it is distended, and you may be able to hear the fluid swishing around in there. Hey, if you see these signs, do not ignore them because I need you to know that your heart can be saved. And heart failure can be reversed through lifestyle, through medication, through reversing whatever is causing it. Don't give up on your heart. Catch it early. My loved one went from a 15% to a